Hello and welcome to Midweek Matters. This week I want to talk about Amma, my mother, and about the condition of migrant labor whom I see every day on my street, and try to understand what does governance mean to their lives during the current deeply troubling times. I live with my mother. Mother's Day somehow doesn't figure as a special day in my calendar. Only the feed in the timeline of my social media alerted me to it. Mother's Day alert started me to think about her, the impact of COVID-19 could have on her, and my fears, anxieties about her in the present uncertain and helpless times. Amma stepped into her 91st year in the middle of April. For her age, she's pretty healthy. No diabetes or hypertension. A bit hard of hearing of late. And a little forgetful. Recent happenings don't register very well in her mind. However, she has robust memory of past events. Mobility is reasonably okay. Sense of humor is intact. She's bewildered why we do not have many visitors for the last 1 year. Even when someone comes, they stand at the threshold of her room, mouth and nose covered, speak to her from far and go away. She's not able to understand why the domestic helps are moving around with masks. She's faintly aware that there is some disease spreading nationwide. While her concern is primarily to make sense of these happenings, my anxieties are more serious, far deeper. If she were tested, she would increase the total number of tested people by 1. If she were infected, it would be another number added to the national total. For people who think in terms of metadata, she would be another number in the 14.74 lakh total daily tests carried out in the country yesterday. If she were to test positive, she would go to make up the 3,05,284 of active daily infections as of 9:30 p.m. on Monday, and one among the 2,29,67,832 cumulative number in the country so far. She'd be datafied. We take ample care, but still, what if she were to be infected despite all the care? Would she get a bed? Get a bed with oxygen? Would she get a ventilator if she required it? What are the chances of us moving her to a hospital in a properly equipped ambulance with a paramedic attending to her? I saw people falling at the feet of doctors and hospital administrators, pleading with them to admit their kin. Would I also need to do that? Could I do that? Would she like me to do that? Would they show compassion if I did that? Would I be able to pay the exorbitant and rapacious hospital charges even if I managed to get her an admission and a bed? What would I do if the hospital told me that their oxygen stock was depleting to last only for an hour or so? Where would I run? Whom would I beg? You might say, well, you know a lot of people, you're well connected. But should I jump the queue? Would I be right in considering that my mother was more important than someone else's mother or father, brother or sister, wife or husband, or a friend? Would Amma be happy to be treated out of turn by denying someone else their fair chance? How would I resolve that moral dilemma? I would not walk past many who were waiting in the line to carry my mother into the ICU ward, or to a bed with an oxygen cylinder, or to a ventilator. I cannot do that. I simply can't throw my weight around. But can I live ever in peace if I had not done that to save her life? Wouldn't that haunt me? Amma led a tumultuous life. Her marriage to my father was an extraordinary event in our area. It was at the dawn of independence in September 1947. Intercaste marriages were nearly unheard of, and a secular marriage, sans Vedic rituals, was unknown. Thousands came to attend the wedding merely out of curiosity, just to see how does it look, the secular marriage between two people from two different and supposedly unequal castes. The bride and the bridegroom formally garlanding each other to become wife and husband, followed by inspiring speeches by leaders and social reformers. Within a year, my father and mother had to go underground. They were active participants in the armed revolt against the Nehru government following the passing of Ranadive thesis at the Calcutta Congress of the Communist Party of India. My father had shoot-at-sight orders on him. Jail was not new to him by then. He was imprisoned under the Defence of India rules during the Quit India movement. But his young wife then had no clue of what it all was. They lived incognito as a teacher couple in the agency area among tribals, ever ready to move away from a place at short notice the moment the place failed the smell test of safety from police search parties. She had a long public life. She served her stint as a legislator in Andhra Pradesh Assembly. Both her mind and body are battle-scarred, toughened by privations, uncertainty, defeats, victories, failures, achievements, betrayals, as well as loyalties. She was and she has an ironclad sense of self-worth. Because of her long association with our native place and strong attachment to the people there, she told me long ago that she wanted to be taken to our hometown on her death and cremated there. In the same smashan where I lit the funeral pyre of my relatively young father then, quite early in my life. God forbid, if something were to happen to Amma during the present crisis, would I be in a position to fulfill her last wish? Leave alone taking her to my hometown, would I be able to give her a decent, respectable, and dignified cremation at the place where we now live? On Mother's Day, the question that pestered me was, can I trust this governance, the state as it stands today, with my mother's well-being and life? I will return to this just in a while. Now, let me give you a brief narration of a conversation I had a few days ago. A new house is under construction just a few streets away from our house. Work is happening briskly. Among the workers are about 20 young Hindi-speaking boys, perhaps in their 20s. A few days ago, I found that they started sleeping at the construction site. On one of my strolls there, I struck up a conversation with them, asked them why they were sleeping at the site. They said they left their accommodation. Too many people got infected there, they said. 8 people died because they could not get treatment. It wasn't safe for them, they told me. A couple of days ago, instead of 20, I found only about 4 of them on the site. I inquired about the rest. They said most of their friends had left for their native places, fearing another lockdown. They told me that they were also planning to leave in a few days. They said last time they had to walk over a couple of 100 kilometers into the interior of Chhattisgarh. They had no work, their meager savings ran out, couldn't pay rents or buy food. There was no transportation there. They didn't want to take a chance this time. While some transportation was available, they wanted to reach their homes. Remember, if a cat sat on a hot stove, it wouldn't sit on a hot stove again. But it wouldn't sit on a cold stove either. There was no trace of anger in their tone, only helplessness, resignation. It looked as if they taught themselves not to expect anything from anyone. At that young age, they were not prepared to trust the system or the government, the society or the state. If there is just one thing clear in their minds, perhaps it is this. They are not prepared to trust this governance with their lives and livelihoods. Indian state is strong. With one late evening announcement, it could make 85% of our currency no longer legal tender. Ration the withdrawal of people's money, made them wait for hours in long queues for months, made families beg the banks for their money to perform marriages. The government could pass laws in a few hours to dismember states, could lock up the entire opposition of a state for months and no questions asked of it. The strong state could pound the terror bases in the enemy territory out of existence, erect tall statues, embark on the construction of a grand new vista in our capital, a new vista to announce the arrival of a new India. But it is not able to fill confidence in the hearts of the poor, the frail, the vulnerable, and the weak. Its strength is of no use to arrest the sharp decline in vaccination. On May 9th, only 18.44 lakh doses were administered in the country. This is much lower than the 35.74 lakh daily doses recorded a month ago. Some privileged among us look at data, metadata, and make unemotional cross-country comparisons and draw conclusions about how better we are in India in comparison to other nations. Our mortality per million is lower or rate of infection less, they announce. They debate whether it is the union or the states which are responsible for people's treatment, health care, their deaths. Some even victim blame. People are infected, they say, because of their irresponsibility. What could government do about it? But you see, those irresponsible people don't infect only themselves. They become spreaders and infect responsible people too. To stop those irresponsible people from becoming spreaders is the task of governance, isn't it? And many become spreaders because they live in crammed accommodations where physical distance is impossible. It's not their irresponsibility. They have no choice. Unmindful of these debates and colorful data visualizations, real people resigned themselves to their fate. Because to them, it is their jobs, their food, their incomes, their health, their sore feet, their lives, and the lives of their kin. not faceless numbers, comparisons with lands that they are hardly aware of. It's lives, not numbers for them. They are uninterested in who's in charge, center, state, municipality, or panchayat. They paid no attention to who among those claimed to have won the war against this deadly pandemic, and are now indifferent to who among them is responsible for lack of treatment at present. The icy stare of resignation from their hopeless eyes matches the stare of cold indifference from the steely eyes of our rulers. On Mother's Day, this question gnawed at me, gouged my mind relentlessly. Would I trust Amma's well-being and life to our governance, to our system of care? No, I am not confident that this governance and its system of care have the likes of her in mind. Nor do they have the likes of the migrant boys I spoke to. While I remain hesitant in my answer, the boys were unequivocal. My privilege, perhaps, is behind my equivocation. At the back of my mind, I probably have this hope that I could somehow swing the system to attend to her. Anger and frustration coexist in me with hope. Their hard-scrabble lives made the boys clear-headed, unequivocal. They're not angry, but they're numb to the reasons for this unfolding tragedy. They resigned. They just withdrew their trust from the false gods. I will stop here today. We'll be back again next Wednesday, lunchtime at 1 o'clock. Stay safe. Look after yourselves and your loved ones. Until then, bye.